Each year, 60,000 Americans die due to blood loss after a traumatic incident. It's National Stop the Bleed Month, so many of us are ensuring we have the right equipment and training to help reduce these numbers. When looking at wound care, I prefer to evaluate using a bucket method. The first being infection control, the second being moderate bleeding, and the third being severe hemorrhage. Infection control wounds are often no longer bleeding, and we simply wrap them to keep debris and other things out of the wound to help prevent that infection. The second, moderate bleeding, comes from something like a nosebleed or a head laceration or a burst varicose vein, many other things, but it's typically a vein or a capillary that is damaged, and there's consistent flow of blood coming from that wound. Severe hemorrhage is characterized by spurting or pulsating blood coming from an artery or some other really large vessel. How we respond to those wounds is determined by the category that they fall into. Infection control wounds, like I said, are typically not bleeding, so we're wrapping them with standard gauze to help prevent that infection. Moderate bleeding, you can use the standard gauze, but it would be much more efficient and much quicker if we used a hemostatic gauze along with it. Severe hemorrhage is a wound that would likely require us to use a tourniquet, a pressure bandage, or a whole lot more hemostatic gauze to help prevent exsanguination. The last thing we want to look at is consider what we have today in our kit and can we find it easily. On the left, you're going to see a bag that seems a little cluttered and is likely overstocked with the infection control gauze. On the right, you're going to see a bag that is stocked based on those three categories. You'll have a little bit of the infection control gauze, as you see on the bottom right part of the pocket. You'll have a few kits that have hemostatic gauze in them to help prevent bleeding during a moderate bleed incident. And on the bottom left pocket, you'll see items that are designed to manage severe bleeding, like a tourniquet, larger amounts of hemostatic gauze, and pressure bandages. Listen, I appreciate you listening. Like, subscribe, and share if you like the content. I appreciate you and have a great day.